Okay, okay.
Like I said, they're,
Right, yes, yes.
everything was good.
Okay,
They may have to edit that part.
all right,
I don't
okay.
know when they'll air.
Sure, okay.
Or what order they'll air.
Right.
So, if you're ready for the second one.
Have a sip of water. But how was that? The volume, everything
No, it
was...
perfect. So when I count down to the 15th,
I'm gonna start.
just end and then stop and just continue looking at the camera.
So even though you said 15, I should stop there.
No, like your timing was fine. If you
Okay.
went over, a couple, yeah, that was over. Yeah. If you went over a couple of seconds or
Okay.
15 seconds, it's not a big deal.
Okay.
Just continue looking right at the camera and give them a good long silence, so they have time to cut it.
Okay,
And then we'll move into the third one.
okay, great. My speech, was it good and no speed? Okay.
No, perfect level and speed.
Uh-huh.
It was
Okay.
very clear.
Okay.
Okay, stand by. 10, 5.
Hello and praise the Lord. Welcome to TBN's Doctor to Doctor program. Hi, I'm Dr. Peter Byro, and I'm privileged to be here today. I'd like to continue on a previous segment, heart disease in women.
Yeah, just don't reference the other side.
Okay, sorry.
5, 4, 3.
Hello and praise the Lord. Hi, this is Dr. Peter Byro, coming to you from TBN's studio here in New York City. Today I'll be talking to you on secondary risk factors for heart disease in women. I'd like to talk about homocystinemia. What we have found is that elevated homocysteine levels is a major risk factor for heart disease. Perhaps cholesterol is not the major culprit here. When women enters menopause, the homocysteine level begins to rise. Other things that can contribute to homocysteine levels includes the lack of B vitamins. It can also be a hereditary component where there's the lack of a deficiency of an enzyme called methylene tetrahydrofolate reductase. What we have found in studies is that homocysteine coupled with hypertension can perhaps increase the risk for heart disease and perhaps a stroke by 25%, 25 times higher. Now, what is homocysteine? It is basically an amino acid that's produced based from ineffective protein metabolism. It can increase inflammation. It can also increase triglycerides and cholesterol synthesis. It also promotes free radical production and activity. Now, there is a theory called free radical theory of aging, where we believe many disorders and disease processes occur from these free radical agents. Now, what's a free radical? It's basically an unstable molecule that goes around the body. It lacks an electron and tries to attack your cells, trying to steal their electrons, in turn, making your cells very unstable. Then disease occurs, oxidative stress, and then cellular death and disease. Now, what do I mean by oxidative stress? Just imagine a piece of metal. You lay it out in the environment. The oxygen, the air begins to cause rusting. That's the same process that's occurring in the body. So we know that's a perfect example of inflammation. We know that inflammation is perhaps one of the major culprits of all kinds of disease in the body, ranging from cancer to heart disease. That's why we talked about inflammation in heart disease, checking your CRP levels. Well, homocysteine can also promote that. It's a very simple way to fix that. We can supplement with B6, B12, and folate. And perhaps if you're not reacting positively with simple folate, you might need to use the reduced form or the more active form called L5-MTHF. Now, other ways of lowering homocysteine levels includes the use of SAMe, SAM/E, about 200 to 400 milligrams a day, has been shown to lower homocysteine. Trimethylglycine also can lower homocysteine levels. What's noteworthy here is that about 40% of strokes, 30% of heart disease, and about 30% of peripheral arterial disease may be caused by elevated homocysteine levels. Those are staggering numbers, and it can easily be fixed. Again, this is something that many physicians do not check. The sad part is that many insurance companies do not pay for it. I know I check that in myself and my wife and our children every year. Every year I get a $200 bill per person. But you know what? I pay it because I don't want to be stuck in that box where the insurance company tells me what to do or what not to do. So I'm encouraging you today, ask your physician, if you don't mind stepping out of the box and getting those things checked, have it checked. It's a simple way to reduce heart disease, strokes. New studies now showing that elevated homocysteine levels can contribute to dementia, Alzheimer's dementia. Yes, you heard it right here. So please, I encourage you, make a note of that. Next, I'd like to touch upon lipoprotein(a). Again, today I'm focusing on the ladies, heart disease in women. When a woman enters menopause, as the estrogen begins to fall, the lipoprotein(a) begins to rise. We know this is a little cholesterol marker that contributes to inflammation. We know patients who are diabetics, another risk factor for heart disease. Diabetics and menopausal women, lipoprotein(a) begins to become elevated. And there are simple ways to treat this. L-proline, L-lysine, L-carnitine, DHA, estrogen replacement therapy, exercise, vitamin C, niacin, which can also raise your good cholesterol. I recommend that you use a flush-free niacin. 1 to 2 grams has been shown to lower lipoprotein(a). Now, here's a biggie. Statin drugs. Many patients happen to be put on a statin drug, and by statin I mean lovastatin, Pravachol, Lipitor, Crestor. These are all examples of statin drugs. So here we are using a statin drug, lowering our cholesterol, but what we have noted is that statins begins to elevate your lipoprotein(a). Any person with an elevated lipoprotein(a), studies have revealed that within 10 years, there's a 70% chance of suffering a cardiovascular event, such as a heart attack. Again, here we are battling hyperlipidemia, a risk factor for heart disease, and yet some of these agents are actually contributing to heart disease. Now, what can we do? As I mentioned, the few simple natural agents that can be utilized. What we have also known as statin agents, it lowers coenzyme Q10. We know coenzyme Q10 plays a very important role in the energy pathway within the cell, in the mitochondria. And that's a whole new topic I'd like to touch on another day. So, coenzyme Q10, I recommend any patient taking a statin drug, supplement with a coenzyme Q10 agent. What we've also extrapolated from studies is that women with a low coenzyme Q10, there's an increased risk of breast cancer. Now we've also noted that an elevated risk of cervical and breast cancer. Now, someone put forward a theory some time ago, or perhaps a hypothesis, that if our cells are lacking in coenzyme Q10, can it contribute to cellular fatigue? Remember that the heart is made of little cells, we call the cardiac cells, or the myocytes. If there's myocyte dysfunction, the cell is lacking in energy. Think about this. Could we be contributing to myocardial fatigue? Making the heart need to work faster, harder, if you already have a compromised coronary vessel? Are we increasing our risk there of heart disease? Again, I'm being rhetorical here. I'm throwing this question out at you. Think about that. Please, again, to summarize, homocystinemia, elevated lipoprotein little a. Estrogen replacement therapy, very vital in lowering lipoprotein little a in women, and it's a significant intervention for heart disease in women. Thank you, and this is Dr. Peter Barrow, coming to you from the studios of TBN. Hello and praise the Lord. Hi, this is Dr. Peter Barrow coming to you from Forked River, New Jersey, and from Johns Creek, Georgia. It's indeed a privilege to be here once more, just to bless you today through medicine. Today I'll be talking in a back-to-school special. And I know right away parents are thinking this is geared towards the kindergartners and perhaps the adolescents and the teenagers, but no. This is applicable to all, whether you're a parent returning back to school or perhaps parents involved in children's educational. As the seasons begin to change from summer to fall to winter, many physicians will be promoting or advocating vaccinations, whether it be the flu vaccine, whether it be the pneumonia vaccine. And whether or not you're a vaccinator, quote unquote, I'm going to recommend a number of things that you can do perhaps to aid and support your immune system to fight against all of the known illnesses or many of the most predominant illnesses plaguing the flu season, otherwise the fall season. Again, there are simple things such as vitamin D. Now, a lot of studies have shown that vitamin D perhaps can modulate our immune system. Vitamin D has been a great immune enhancer, fights against autoimmune disease, and it's also called the sunshine vitamin. No, it's not vitamin C. Yes, vitamin C is very effective and so on in building our immune system, but I highly recommend you have your physician, first of all, double check your vitamin D level. I want you to look for an integrative pediatrician or an internist who's trained and well-versed in the area of integrative medicine and holistic applications. I know it's very rare to find one of those, but they are there. So when you're checking vitamin D, you want to check the vitamin D25 hydroxy level. And when you replace it, you want to replace with vitamin D3, not vitamin D2. D2 comes from plants, but we want to supplement with vitamin D3. Again, vitamin D has been shown to be very effective against autoimmune disease. Studies coming out from Europe have shown perhaps a fight against diabetes and heart disease. Now, what is it about the increased incidence of infections during the winter? Is it because of the cold temperatures? We think not. Is it because of the lack of sunlight? The sunshine vitamin is diminished. And so we say maybe it's the vitamin D deficiency or the lack thereof that's contributing to this increased incidence of the flu and perhaps other infections. So that's a quick one, vitamin D. Next, I want you to concentrate on perhaps a probiotic. Now, what's a probiotic? Well, it's just a natural bacterial agent meant to repopulate and to supplement your intestinal bacterial flora. Many patients will be treated, for example, for ear infections, bronchitis, pneumonia, et cetera, et cetera. And when the antibiotics begin to fight against your infection and the known etiologies, it also destroys not only the bad bacteria that's causing your illness, but it's also contributing to the destruction of your healthy flora. Now, studies in integrative medicine and holistic practices have revealed that our immune system begins here. Yes, right here. Our gut is perhaps the heart of our immune system. So here we are trying to fight off infections and destroying a healthy bacterial flora. And years later, you're wondering, why do I have IBS or other gut issues? Why am I more prone to infections? So get a good probiotic. Again, these things I'm recommending or are suggesting, I want you to discuss them, first of all, with your physician. I don't want you to go out and implement these changes on your own. I want you to discuss them and make sure there are no contraindications to what I'm recommending or suggesting here. Next, omega fish oils, very healthy for brain health, cardiovascular health, joint health, and immunity. In children, DHA has been shown to be very powerful as a brain enhancer for intelligence. During the fall seasons, there's studies have revealed a higher incidence of depression. Now, big pharmaceutical agents, companies, for example, have gone out and made a omega fish oil product called Lovaza. So I want you to talk to your physician. Consider an omega fish product, fish oil, that usually has a combination of EPA and DHA. I have my child who's 6 years of age. She has 4 omega fish oils every morning, and she requests it. So we're training her up in that way to eat healthy. Next, I want to take you to exercise. In the winter, most people hibernate. That includes our kids and so on. I want to caution you, I want to encourage you to fight against obesity. What we have noticed in studies is that children, as they begin to age, in the younger years of life, as we begin to feed them these high-calorie foods, and in winter, many are somehow craving. There's an increased crave for carbs and these high-calorie foods. What has been noticed that these excessive calories will increase the risk of adipocytes or fat cells. So as we get later on in life, these numbers of cells which have already formed in childhood begin to expand. It's known as hypertrophy. It begins to expand, and in the 20s and in the 30s, we notice, wow, why am I putting on the weight? So we could perhaps start in the younger years of life to fight against obesity or the formation or the causation of obesity rather than starting when you're 20, 30, 40 years of age. So start in the younger years of life. Train your child to eat healthy. If you're going to eat a lot of carbs, mimic the light cycles. For example, during the daytime, increase their exercise and outdoor activities. And if you can't, well, play a little games. At my home, we play tag. So I'm running around and around, jumping from sofa to sofa with my baby, just like a little child again. But that's my way of getting her to exercise. So yes, next, simple things such as hand washing. We know viruses can easily be spread for the droplets from our nose. And so we spread it to each other. So the child brings it home, passes on to the parents, and there's a circle that goes on, consistent spreading. So in addition to vitamin D, probiotics, omega fish oils, I recommend a good multivitamin. Again, I want you to stay away from the gummy bears, as was recommended to me by my dentist, my pediatrics dentist, because gummy bears tend to get stuck in our tooth, and it has lots of sugar, increasing risk of dental cavities. So a good multivitamin. Ask your pediatrician to double check these things. It doesn't matter what age the baby is. Even in adulthood, please double check your vitamin D levels. Again, this is Dr. Peter Barrow. It's been a privilege being here today. And remember, by his stripes, you are healed. Sure. Mm-hmm, mm-hmm. Hello and praise the Lord. Hi, this is Dr. Peter Barrow coming to you from Fork River, New Jersey and Johns Creek, Georgia. It's a privilege to be here today and to bless you. Today I'm going to present perhaps one of the hottest topics at the time of this airing in obesity or being overweight. It's called leptin resistance. And my topic is basically deactivating the fat switch. Yes, I know many of you today, perhaps, who are plagued with being overweight or obese. I've perhaps sought out many physicians who've checked your thyroid, have undergone a thorough workup, but yet the question has arisen in your mind, why can't I lose the weight? Why can't I lose that last 10 or 20 pounds? Why is it so difficult? I've fasted, I've dieted, I have a personal trainer, but yet nothing seems to work. Well, perhaps one of the hottest things in the weight loss world right now, based on research, is leptin and leptin resistance. Now, first of all, what is leptin? Leptin is a hormone, and as many of us know, a hormone is basically a chemical messenger. It transmits messages from one part of the body to the other. Secondly, I want to focus on the hypothalamus. The hypothalamus, which is a small organ in the brain, in that area is the feeding or the hunger center. So, to simplify this talk, I want to tell you that leptin, which is released from our fat cells or the adipocytes, basically are released and it circulates through the bloodstream and it gets to the hypothalamus and it sends a certain messages. What does it carry? Well, first of all, it tells us about our metabolic status. And I know many physicians are saying that our thyroid gland is perhaps the gland of metabolism, but I say not at all. Leptin is more important than the thyroid gland when it comes to weight loss, perhaps the dominant hormone. Secondly, it talks about or transmits a message with reference to our endocrine status, the hormonal status, and our energy status. So once the brain gets that information from leptin, it then sends back another message to other parts of the body where it regulates glycemic or sugar control, energy storage and expenditure, and nutritional status, and also all the neurohormonal status in every bodily system. So once these messages are transmitted, certain hormones are released from the pituitary gland. The hypothalamus sends a signal to our pituitary gland, which also releases many other hormones. So here, to simplify the subject, we have a meal. The sugars and the excessive calories begin to send a message. It stimulates the fat cells to release a message that goes up there and relays that, hey, I am full, stop eating. In many of us, this message or this transmission is broken and the communication is lost. Over time, the person becomes leptin insensitive. And again, with time, becomes resistant. So here is the body we're having a meal, the leptin is being released, but the communication which is lost to the brain begins to sever that signal back to our state of hunger and saying, hey, I'm not hearing anything. The patient or the person is starving. So because of a loss of communication or a leptin resistant state, you find yourself having these excessive craves and hunger. After your meals, wow, why is it I'm still hungry? I need a snack. That's leptin resistance in a simplified form. Now, how can one monitor or measure one leptin state? Well, there are certain labs that are doing these testings now, and it's believed that many of these labs perhaps are missing a boat or underestimating our leptin state or leptin levels. So I want to recommend that you find a physician who's trained and well-versed in this area of weight control and leptin resistance. Not someone who read a book or did a little crash course on the internet. Someone who's well-versed in this area. Quest Diagnostics and LabCorp is now offering leptin levels. Once you have established your leptin state, again, even without checking the level, a physician astute in this area can perhaps diagnose you by just a few simplified questions. Now, what can be done to turn off or deactivate that fat switch? Well, first of all, studies have recently come out saying that sleep deprivation are activating our our hunger centers in the brain. So sleep-deprived patients find there's an increase hunger, there's increased hunger, there's increased desire to snack and to feed. So I'm going to recommend, first of all, sleep. Get 8 hours of sleep. Again, there may be many other mechanisms that's involved in weight gain with a lack of sleep, perhaps growth hormone. We know there's a pulsatile release of growth hormones 2 hours after we go into a deep sleep. If you're sleep deprived, if you have broken sleep, you're affecting that hormone from being released or diminish in its production. And again, we know growth hormones are it's one of the lean bodybuilding hormones. Next, I'm going to recommend something called L-carnitine. L-carnitine has been shown in studies to actually fight against leptin by lowering weight. That's one of the best ways of lowering leptin resistance and making the body more sensitive to leptin. That is losing the weight, but that's the paradoxical question. In the first place, how do we lose the weight? Next, we want to recommend organic meals. There are certain pharmaceutical agents that are out there that perhaps have been utilized to fight against diabetes. But again, some of the studies have shown perhaps these things may be used to fight against leptin. I usually don't go that route. I like to stay more natural. So in addition to your 8 hours of sleep, L-carnitine, and there's a whole vast of other protocols I can recommend, but because of time limitations, I cannot. Next, I want to just blurt out a little thing on HCG. There are many physicians who are promoting HCG and this very low-calorie diet. I want to caution you against that. Again, the final decision rests in your hands. But what we are noticing in a very low-calorie diet, a 500 to 700 calories diet per day, 6 or 7 months later, there's a massive rebound in weight gain. I just want to divert real quick and throw it out. Next, have an adequate set of your hormones checked. In addition to leptin, check all the other hormones, your thyroid hormones, your cortisol. We are fighting a battle up here, and the hypothalamus is picking up these battles, these rage, anger, depression, stress in every form. And it sends a signal to our pituitary gland, which in turn sends a signal to our adrenal glands. We know the adrenal responds with a raise in the cortisol. When that becomes elevated, weight begins to go up. So I'm going to recommend that you find a physician, again, who is well-versed in this area of complete hormonal restoration, who knows how to check all the hormones, including your leptin. Again, this is Dr. Peter Barrow coming to you from the studios here in New York City. It's been a privilege and a blessing to you. And again, I want to remind you, by His stripes, you are healed.